morning. My name is Dr. Ricky Choi, and I strongly support both the public insurance option and the inclusion of new legal immigrants into health programs and subsidies. As a healthcare safety net pediatrician, I see the difference between having and not having health insurance every day. Children and their parents need a medical home where they have a relationship with their doctor and their health issues are addressed. Without health insurance, children miss needed vaccines, developmental delays such as autism are missed, chronic illnesses such as asthma go untreated. For children, this form of neglect, and I regard this as societal neglect, can have long-term consequences. As discussed today, the lack of health insurance is a significant concern for the Asian community. All too commonly, families go without health insurance, gambling that they won't get sick or get into an accident. And though I'm a doctor, my own uncle and aunt are among the 30% of Korean California residents who do not have health insurance. It's just too expensive, and sending their daughter to college is more important. But with the economy in a recession, many families are slipping through the cracks. Some families are not seeing a doctor for their health problems or preventive checks because of a loss of a job and their employer-based insurance. The recent cuts to the state children's health insurance program, Healthy Families, has been a disaster for children. Right now, over 77,000 of California's children are without insurance and instead on a waiting list to get Healthy Families. Because of federal laws, legal immigrants in most states have to wait 5 years before they're eligible for Medicaid or subsidies toward health insurance, even though they pay the same taxes as citizens. These families cannot sit in an indefinite waiting list or wait 5 years for vaccines and medications. Our society is failing our families and failing our children. And because diseases like swine flu do not discriminate based on income or immigration status, we're also failing our communities. We desperately need health reform in this country. A few months ago, I saw a 16-year-old young man who had not seen a primary care doctor in years because his family did not have regular health insurance. In 2007, after playing with some friends, he dislocated his left knee and fractured his left ankle. He required surgery, during which screws and metal plates were required to keep his ankle together. And afterwards, his family moved, and he slipped through the cracks. When I saw him a few months ago, he was walking with a cane and complaining of pain. Though previously active in sports, he has been unable to run for the past 2 years. He's now obese. His cholesterol levels are abnormally high. His mother and sister were concerned that he was getting depressed, and he's only 16. This family had few options for health coverage. His mother is a single parent and works as a massage therapist. Private insurance was too expensive. The public insurance option will address 2 important issues in health reform. The public option will help decrease costs through competition, as we have discussed, so more families can afford insurance, and thus more people will have access to health care. By lifting the 5-year bar, legal immigrants can get access to Medicaid or federal subsidies toward health insurance. Our ethnic communities are uniquely vulnerable in this area, but if together we can bring those changes to our healthcare system, they will surely uniquely benefit.